Doreen 𝗂𝗓𝗄𝗃 is the
Dr. Doreen is an expert in autism.
Doreen 𝗂𝗓𝗄𝗃.
Dr. 𝗂𝗂𝗧.
Dr. Doreen 𝗂𝗂𝗂𝗃.
Dr. Doreen 𝗂𝗂𝗧 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Andrea's got a question for us. She says, actually, I have two questions. First, what is the average number of trial sets per hour for a 3.5-year-old who's been in ABA full-time for 6 months? Second, if I switched my son's ABA clinic, how much of a setback can I expect? And do you advise against doing this?
That's great. I love that question. The reason I love this question, Andrea, is that this is clearly coming from some BCBAs will be talking about things like there should be X number of trial sets per hour. And that is not something that I support. Every child is different and every lesson is different. So for instance, if I'm teaching a child, some children, I want to give you lots of different examples. Some children have what's called a slower response time. So they are responding, but they just need a little bit more time to think. And it's very important for the providers, for the clinicians to know that, to learn that about the child, because what happens is I give an instruction, I have to be able to wait long enough for the child to respond. It can't be too long because then the child will either get distracted or do some sort of challenging behavior, or they'll learn non-response. But it also can't be too short of a time, because if it is too short, then I am never giving the child the chance to think and get a response across and then get their reward. So it's super important. I tend to be one of those people that wants our kids to answer fast, so I'm always trying to keep the pace fast. But when I observe children, I've learned, like I have a child right now that I observe the team, and the team gives the child a lot more time, and his success rate is higher just because they give him more time to process. So it is very important for your team to identify what's the processing time of the child. So that obviously will alter the trial sets. And trial sets are not important. Trial sets are like 10 trials per whatever. And here's the other thing I want to tell you about trial sets. If it's a very easy lesson, like for instance, matching of objects, which is like sorting, you will have many, many more trial sets than if it's a very difficult lesson, like an intraverbal, or something that involves a series of actions, or a series of, or a long response, or some sort of social skill or conversational skill, or if you're in an NET type program. I mean, there's a million reasons why the number of trial sets per hour will vary. So if someone is telling you there's got to be X number of trial sets per hour, you need to go back and say, well, what if it's an easy lesson or it's a harder lesson? What if the lesson requires more processing time versus less processing time? And all of those types of things interact with the child's response level. So that hopefully will answer your first part. The second part is sometimes you just have to switch. And you find that you're not getting along with whoever the people are at that particular clinic. Sometimes you have great clinical staff, but not very good operational staff managing the clinical staff. Sometimes you have an organization where they have very high turnover, and so you never have the same team. There's reasons why it's better for your child if you move to another clinic. No, it's not going to be a major regression. Yes, of course, our kids get attached sometimes to their therapists, but they will move on if they have better therapists. Make sure that you are changing for the right reasons. And, Shannon and I can certainly talk more about what is a good ABA provider. But if you're doing it for the right reasons, don't worry. It's not a setback. Do it. Get your hours. Get it from good clinicians, and don't be worried about it.
Amazing. I'm seeing a lot of things that people are writing in. We're going to get to as much of it as we can, you guys, but I'm loving the chat here. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.